pregnancy and chickenpox. A very important aspect of this disease is that every pregnant woman should understand and know her gestational age. So, if she seeks medical attention within the first 24 hours after the appearance of the rash, and her pregnancy is at 20 weeks or more, it's important to remember that the risk of pneumonia increases, specifically pneumonitis, the so-called pneumonitis of the second half of pregnancy. These women are prescribed, and this is even according to protocol, aciclovir, women in the second half of pregnancy. If those 24 hours have already passed, this is also very important. If a woman is less than 20 weeks pregnant, aciclovir is not always considered as a treatment option for this patient. She is isolated. For example, we still remember the Belzer isolation box, but most often women stay at home, so they are simply isolated. Once again, it's very common for us to recommend that you have your own cup, spoon, towel, and personal hygiene items, right? Up to 5 days from the appearance of the last vesicular rash. At this point, this is how she is isolated. It's very important here to remember how children are isolated. Very often these children are the first child in the family. So for those under 7 years old who haven't had, say, chickenpox or shingles, they are separated from the 9th to the 21st day. It's very important to remember this. It's very important to know this. After contact with a sick person, again, even if the contact was with someone with shingles, if the doctor diagnosed herpes zoster. As for pregnant women, making the correct diagnosis is always very important in this situation. Pregnant women are prescribed tests for immunoglobulin G antibodies to chickenpox. This is fundamentally important. If we get a positive result, it means the patient has already had chickenpox, and this is not chickenpox. If the mother becomes infected during childbirth, it's always very important to remember at what stage the infection occurred. A newborn baby can get chickenpox. This is called perinatal chickenpox. It carries significant risk for both the fetus and the newborn baby. If the mother becomes infected 1 to 4 weeks before delivery, half of the children will be infected. In about a quarter of these children, chickenpox will manifest clinically. Even if the mother has some passive antibodies in her blood, it is also very important to remember this. Situations can be very different, as we have discussed. Whether it was chickenpox when it was first diagnosed, whether it is chickenpox now when it is diagnosed again, or whether it is a primary infection, it's always important to remember what we are dealing with. If a child is born within 7 days, or 7 days after the mother develops a rash, it is very likely that the child will get chickenpox. This will be perinatal chickenpox, and it can take a severe form. Therefore, be sure not to forget to consult with your therapists and gynecologists. It is always essential to understand which medications need to be prescribed, whether they need to be prescribed, and how to proceed further. The maternity hospital must be informed about this, and all discharge summaries should include this information. This is very, very important. As for the transfer of antibodies, I might be asked about that. The transfer of antibodies from mother to child. So up to 26, up to 28 weeks, we are now considering those newborns. Let's focus on newborns now. 28 weeks is the gestational age. So for babies born before 28 weeks, unfortunately, they are not protected against chickenpox because transplacental antibodies do not reach these children. That's why you should always keep this in mind, at what gestational age the child was born and when you became ill. This is very important. Regarding fever medications that pregnant women take, paracetamol is definitely allowed for all pregnant women. Do not mix it with other medications. It's better to buy pure paracetamol and take it in the dosage appropriate for your age and body weight, as calculated by your therapist or gynecologist. Paracetamol can be taken at any stage of pregnancy. It has no contraindications. And you should always remember about the medication ibuprofen. It should be used very carefully and must not be used after 27 weeks of pregnancy. Up to 27 weeks of pregnancy, it is quite possible to use this medication as well in those dosages that will be effective for you without exceeding the dosage specified in the instructions. There is a question: why can't this medication be used after 27 weeks? It is very important to monitor this, even if you are going to use it and it is prescribed to you and the ductus arteriosus in the baby will be monitored. Then it makes sense to take this medication. Everything depends on the gestational age and on the gestational age and the continuity of medications. If unfortunately paracetamol does not help you and it is decided to prescribe ibuprofen after 27 weeks, I repeat, after 27 weeks, it is very important to remember about the closure of the ductus arteriosus. A scheduled ultrasound is performed, an examination of the baby in utero, where this specific ductus arteriosus is examined. As soon as there is any suspicion of narrowing of the ductus arteriosus, ibuprofen is strictly not used. Further management depends on how the pregnancy progresses, but it is very important to remember that after 27 weeks, under no circumstances, or be very careful, with ibuprofen. And we also talked about acyclovir, 800 milligrams 5 times a day. This is etiological treatment. So the adult dosage is the etiological treatment even for pregnant women. Breastfeeding can be continued. There are some nuances. If there are vesicles near the nipple, right by the areola where the baby latches, then you really shouldn't breastfeed the baby. You should express the milk and feed the baby with expressed milk until scabs form. As we mentioned, the last element of the rash in chickenpox. Once scabs have formed, you can gradually start breastfeeding the baby again. During the period of active new eruptions, try not to breastfeed the baby.